Hi all, welcome to Transplant Anesthesia Academy. Today we are going to deal with one important monitor. Here you can see a goalkeeper trying to save the goal. He succeeded in it and he is very happy. This is like your operation success. But look what has happened. He has saved the goal. But what has happened? It is a goal. That is, you have done the operation successfully, but the patient not waking up. That is the worst possible scenario which an anesthetist or a surgeon can face in the perioperative period. So what all can be done? Whether cerebral oximetry is going to be useful to prevent such event. So next another 25 to 30 minutes, I will be giving a brief history about cerebral oximetry, a small introduction, and what is the technology or the working principle behind cerebral oximetry and what are its various limitations, and about various clinical studies, what are the advantages and disadvantages in using cerebral oximetry, interesting case reports, and finally with the meta-analysis and forming a protocol, and finally conclude whether it is useful or not. The word monitor was derived from Latin moner, which is mean to warn. So what is intelligent monitoring? Intelligent monitoring enhances safety, improves the patient outcome, and provide a therapeutic window for the clinician to act. That is intelligent monitoring. But what is mandatory monitoring? It should be accurate, reproducible, cost effective. It should be mostly invasive, but if needed it can be invasive, and should provide correct information, and it should lead to better clinical outcome, and it should be sensitive and specific. Whether cerebral oximetry is intelligent or mandatory, but what we are going to monitor is a mysterious organ. Okay, you are going to monitor the brain. It is going to be really difficult to have a monitor to determine the functions of brain, which nobody can know, and your anesthetics have known to interfere with your electrophysiological function of the brain, so it affects the monitoring too, and it is technically difficult and demanding, and there is only limited data to support the improvement outcome. And the last important part, there is difficulty in interpretation. In what way? Your reading might be abnormal, showing that patient is having CNS injury, but the patient awakens without any neurological damage, or the reading might be absolutely normal, but the patient might have a stroke. So these are the problems with interpretation in a CNS monitor.